A crisis within a crisis. That's how health experts describe the large number of Black and brown Americans dying from COVID-19 compared to white Americans. Tonight, ABC Action News reporter J.J. Burton takes a deeper dive into this issue. He went out to talk with Bay Area doctors who tell him this disparity is a direct result of the implicit bias within the healthcare system.
March 22nd, 2020. That's the last time St. John Progressive Missionary Baptist Church met in person for Sunday service. Until now.
Bring it on,
But they're outside in the parking lot.
I want my hope back.
And due to the coronavirus, Pastor Bartholomew Banks says this is the safest way for him to preach to his congregation. It's the same for most churches, especially those in Black and brown communities.
We just take it very seriously.
According to health experts, the virus is hitting Black and brown communities across the country harder with fewer resources to save them.
So that's a priority for us because it is disproportionately impacting our people.
Now take a look at this. According to the Centers for Disease Control and Prevention, although Black and Hispanic Americans are almost as likely to contract the virus just as white Americans, Black people have nearly 3 times the hospitalization rate of whites and twice the death rate. For Hispanics, it's much higher.
That was enough to tell you and kind of warn that we had a particular problem that was occurring all over the country.
The Dean of Pharmacy at USF, Dr. Kevin Sneed, says the virus has blown the lid off of a major issue that has plagued minorities for decades: implicit bias within the American health system.
It's been the structural components of lack of access to health care, socioeconomic opportunity, lack of education, and other social determinants of health. They really kind of set the stage to allow the virus to come in and so negatively impact these communities.
And Dr. Sneed says it's important for people to understand COVID-19 and implicit bias are 2 different problems. So with that in mind, while the vaccine may save us from the virus, the crisis of implicit bias in our healthcare system is much more complex.
The entire system has been conditioned into a level of acceptance. We're not making the kind of changes and transformations to the healthcare system overall that would truly allow us to move beyond.
In Tampa, J.J. Burton, ABC Action News.